Hi everyone, my name is Rebecca Decker and I'm a nurse with my PhD and the founder of Evidence-Based Birth. In this video, we're going to give an overview of the benefits and risks of epidurals for pain management during labor. Hi everyone, and welcome to this video all about the evidence on epidurals. Our last research update on epidurals at Evidence-Based Birth came out about 6 years ago. So today I'm excited to share some new updated evidence with you. We're going to be talking all about the effectiveness of epidurals, the benefits, risks, alternatives, and what do the professional guidelines say? So epidurals, spinals, and combined spinal epidurals are pharmacologic or medication methods of helping manage pain during labor. They're often referred to as regional analgesia. Analgesia means pain relief and regional means a part of your body. Sometimes you'll also hear them referred to as neuraxial analgesia. And this is a common way of managing pain during childbirth, specifically during vaginal births, but also sometimes during cesarean births, although in some emergency situations, you might see general anesthesia or gas used to manage pain during cesareans. Epidurals are really common in the United States. About 70% of people have an epidural or similar method during labor. This is pretty high compared to other high-resourced countries. For example, in England, epidural use is around 20 to 30% of vaginal births. In the Netherlands, it's about 30%, Sweden, about 45%, and Ireland, 65%. So let's talk all about epidurals and what they are. First of all, so an epidural is also sometimes called an epidural block. This is when a catheter is placed in the lower part of your back in an area right underneath where the spinal cord comes to its end. An epidural can block feeling in the lower part of your body, also causing some numbness, but you remain fully awake and aware in the birth experience. Whether or not you can move your legs depends on the dose and the type of medication you're given. So how do you get an epidural? Well, after getting your informed consent, a trained licensed healthcare provider inserts a small needle into your back, and over on top of that needle, a small catheter is threaded over it. This is the epidural catheter. The needle is used to guide the small plastic catheter into that epidural space in your back, right below the bottom of your spinal cord. And then medication is given through that tiny catheter or tube to help with pain relief during labor. Additional medications or higher doses of medications can also be given to numb you up even more if you need a cesarean or if you need a vacuum or forceps assisted delivery. Now, after the catheter is inserted into your back, they retract and remove the needle, so you do not have a needle sticking in your back. It's just this thin plastic tube. If everything goes well, it takes about 10 to 15 minutes to set up the epidural, and then it takes another 10 to 20 minutes for the medication to start working. An epidural does not always work well at first, and sometimes medications may need to be adjusted so that you get the pain management during labor that you're looking for. Also, there's always a chance that the epidural might not work. It might not have been placed correctly, or there's something else going on where it's not working correctly. Epidural medications consist of a local anesthetic, so it's usually bupivacaine or ropivacaine. Those are commonly used in the United States, and then they're often mixed with an opioid. So using both an anesthetic and an opioid allows for smaller doses of each type of drug. The two opioids that are typically seen in the US in epidurals are fentanyl or sufentanil. Sometimes epinephrine or sodium bicarbonate are also added to the epidural to enhance its function. So epidural medication can be given in a couple of different ways, depending on the options that are preferred to be used at your hospital. So a continuous epidural infusion is where a small continuous drip of medication is being pumped through the catheter into your back. And then we have something called a bolus. A bolus is like the medical term for an extra dose of medication or fluid. So sometimes you'll have a continuous infusion. Sometimes you may have boluses given, a small dose given to you at certain times, or you may have both, where you have a continuous infusion, plus the doctor may order a bolus to be given at one point or another. There are also patient-controlled boluses. This is known as patient-controlled analgesia, where they give you a little button attached to a wire that then tells the pump to release a dose whenever you need it. However, these types of PCA pumps are programmed to only allow a certain number of doses within a specific time span, and they have locks in them so that they can't be tampered with. In research studies, they have found that intermittent boluses, along with patient-controlled analgesia, lead to better health outcomes compared to continuous infusions with patient-controlled analgesia. And some of the better outcomes include lower use of forceps and vacuum deliveries, shorter labors, and less need for medication while still providing high birth satisfaction. So that's an epidural. What about a spinal? You might have heard of a spinal block, and it is somewhat like an epidural. It's given as an injection in your lower back, but it's given with a much smaller, thinner needle and with a much smaller dose of medications. These medications are being injected into a sac of spinal fluid that's right below the bottom of your spinal cord in your back, and it causes a loss of sensation in the lower body. A spinal block is usually only given once during labor. It's given as an injection and then the needle is retracted, so they're not leaving a tube in your body, and it provides immediate pain relief. So it starts working right away, but the main drawback is that it only works for about 1 to 2 hours. So because of this, it's primarily only used for people who are expected to give birth very quickly within an hour or so, or sometimes it's given with stronger doses of medications to block all feeling during a cesarean. So you can also combine an epidural and a spinal into something that we call a combined spinal epidural, or CSE. With this method, you get the benefits of both methods. So you get the immediate pain relief of a spinal, you get the more long-term pain management of an epidural, and you can also use lower doses of medications with the CSE. And sometimes you might hear people refer to this as a walking epidural, because if lower doses are used, you might be able to retain some mobility. However, there has been a Cochrane review where they combined a whole bunch of research on CSEs and traditional epidurals, and they found no difference in your ability to be mobile with an epidural or a CSE. So it's really debatable whether we can call it a walking epidural. One of the drawbacks of a CSE is that studies have shown an increased risk in the baby's heart rate dropping with the CSE compared to a traditional epidural, but this has not been shown to impact your chances of needing an emergency cesarean. And the CSE tends to give you a higher chance of having kind of this uncontrollable itching sensation all over your body. So that's more likely with the CSE than with the epidural. One more method, and this is new to this video, you may come across or hear about something called a dural puncture epidural, or DPE. This is a newer technique in anesthesia. It's a modification of the CSE and the traditional epidural method. And there has been a systematic review comparing the risks and benefits of this method to the traditional epidural. And they found that although pain scores were lower in the dural puncture epidural group, and they had less nausea and vomiting, but it was not a huge benefit in pain relief. And because of this, many researchers say we need more research on this method before we can declare that it is superior to a traditional epidural or CSE. So what are the benefits of having an epidural spinal or combined spinal epidural? They all pretty much carry similar benefits. So when I'm talking about benefits and when I'm talking about risks or side effects, they kind of apply to all of these methods. Now, the main benefit of regional analgesia is that it is considered the most effective form of pain relief for labor. A Cochrane review was conducted that included 40 different types of studies with more than 11,000 participants. And in these studies, they were comparing you receiving any type of epidural during labor to any other type of pain relief, such as injectable opioids, which we cover that in a different video, but that means like IV or intramuscular injections of opioids. And in some of these studies, they compared epidurals to no medication pain relief at all. Most of these studies, though, were comparing epidurals to injectable opioids. And they found that those who were randomly assigned to receive an epidural had less pain and higher satisfaction with their pain relief, and they were 90% less likely to need additional methods of pain relief compared to those who were just given opioids injectable. They were also less likely to have problems with their breathing or respiration. They were less likely to need oxygen, and they were less likely to have nausea and vomiting. Having an epidural did not increase the risk of cesarean. It also did not increase the risk of having severe tears in your perineal area. It had no impact on rates of postpartum depression, backache, headache, itching, shivering, or drowsiness. Researchers have also found that epidural type medications are also safer for the baby compared to giving pain medications directly through an IV, which makes sense because a lot lower dose of the epidural pain medication will reach the baby in utero as compared to giving something directly through your vein. Another benefit of epidurals during labor that is not mentioned in these studies, but we've seen it with graduates from our childbirth class, is that people report to us that if they are feeling really tired or exhausted from a long, painful labor, epidurals can help someone relax and get some much needed sleep if they've been having this long labor, and then they can wake up and push their baby out with more energy because they were able to rest. Having an epidural in place during labor may also benefit you if you're at high risk for needing a cesarean. If an urgent cesarean was necessary and you already have a functioning epidural in place, the existing epidural could be used for the surgery by simply adding a higher concentration of medication. According to ACOG, or the American Congress of Obstetricians and Gynecologists, converting an epidural to a higher concentration of medication takes about 10 minutes, and it can be done while you're preparing for transport to the operating room. On the other hand, if you're laboring without an epidural and an emergency or urgent cesarean is necessary, you will likely receive either a spinal for anesthesia or general anesthesia given through a mask before the surgery. In expert hands, ACOG says it takes only about 8 minutes for a spinal block to reach the correct level to perform surgery. However, it is possible that there can be problems placing the spinal, which could cost time during an emergency. General anesthesia is used in only about 6% of cesareans in the United States, and that is the quickest method to use during an emergency, but it also increases the risk of complications from anesthesia. One more benefit noted in the research about epidurals is that the problem with pain, if you do have severe pain or suffering where you're not coping well with labor, this can lead to a higher stress response in your body, which can then decrease blood flow and oxygen to your baby. So it's thought that effective pain management can reduce your stress levels and improve blood supply and oxygen flow to your baby. So those are the main benefits that have to do with epidural pain management. And again, the primary benefit has to do with its effectiveness. So let's move on now to the side effects of epidurals, spinals, and combined spinal epidurals. So let's talk about some of the more common risks first. The Cochrane Review found that epidurals are very effective with pain management, but they also can cause side effects. With an epidural, you're much more likely to experience low blood pressure during labor, which can make you feel lightheaded or nauseous and may require additional IV fluids or medications to manage your blood pressure. A drop in your blood pressure can also compromise the oxygen status of the baby. You're also much more likely to experience something called a heavy motor blockade, and that means that your legs might become so heavy, numb, and difficult to move that you can't really move the lower part of your body at all. This does not happen to everyone, but you're more likely to have this if you have an epidural, and particularly if you have high doses of medications in your epidural. Now, older research found that epidurals led to a higher risk of needing a forceps or vacuum device to help get your baby out during the pushing phase. But when researchers only looked at more recent studies published after 2005, they found that this increased risk no longer existed. And they think that this is because modern techniques of administering epidurals that use lower doses of medication have led to kind of eliminating this increased risk for forceps and vacuum delivery. Another really common side effect that has been verified in the research is that you're much more likely to have a fever during labor with an epidural. You're also more likely to lose the ability to control your bladder and to urinate. And so often there is a catheter inserted into your bladder to help drain your urine during labor. Another thing to note about epidurals is you're more likely to have a longer second stage of labor, also known as the pushing phase, and we're going to cover more details about that in a separate video. Other risks and side effects from having an epidural, spinal, or combined spinal epidural include feeling itchy, having itchy skin, and for combined spinal epidurals more specifically, there's a higher risk of your baby's heart rate dropping or having bradycardia. Here are some side effects that are less common but still might happen. You might feel sick or nauseous, although this is less common with an epidural than it would be with injectable opioids. Spinal headache is another uncommon side effect. This is a painful headache that does not go away with pain medication, and it can be treated with a procedure known as a blood patch. Epidurals can cause you to have slowed down breathing and drowsiness. You may also have a temporary sore back from the epidural needle. You may have some temporary nerve damage that feels like tingles or pins and needles, but this usually resolves within days or weeks. Also, something that can happen, but it's less common, is that the epidural does not work at all, or it only works on one side. Now, looking at more severe complications, things like permanent nerve damage, seizures, severe difficulty breathing, or death are extremely rare. In fact, death from epidurals is so rare that in one study that looked at a 10-year period across the entire United States, they found 0 recorded deaths from epidurals during that time period. One more thing to think about with epidurals is how it may impact your birth experience. So it may be an effective form of pain management, but it also is going to lead to use of more interventions. So you can think of an epidural as a bundle of interventions that kind of all go along together. It's not that you just get the epidural, because there will likely be continuous blood oxygen monitoring. So you'll have something on your hand or your finger to measure your oxygen with a probe on your finger. You'll likely have a cuff on your arm to measure your blood pressure frequently. And you may need extra IV fluids, so you'll have to have an IV hooked up to fluids. You may need Pitocin or oxytocin to help speed up your labor. This is because of the way the hormones work in labor. Having an epidural can slow contractions down, so you'll need extra Pitocin to help with that. Many people who have epidurals end up needing a catheter in their bladder. Also, you will likely need to be on a continuous fetal monitor and contraction monitor, and so you'll have several belts strapped around your abdomen. So we've talked about the benefits and risks. I just want to briefly mention that there are some alternatives to epidurals. So when it comes to planning your birth, it's important to have alternatives in mind because there's no guarantee you'll be able to get an epidural at the time that you want it. Sometimes there are reasons why they cannot give you an epidural. Sometimes they may not work effectively. So you can also think of comfort measures as being part of this amazing toolkit that you can pull from it what you need. You can have comfort measures that you use, for example, on the way to the hospital, or before you get the epidural, or while you're getting the epidural, or after you've received it. So we cover comfort measures in the evidence-based birth childbirth class. We have 2 weeks of our 6-week class is specifically focused on comfort measures. If you're not in our EBB childbirth class, we also have a pocket guide to comfort measures in our shop that goes kind of A through Z, all of the comfort measures that we're aware of, including medications and non-medication ways of relieving pain. And some of these include methods like, well, for example, for other medications, there's nitrous oxide, also known as laughing gas. There are injectable opioids. And then non-medication forms of comfort management include getting in a tub of warm water, hiring a doula, using meditation, a birth ball, yoga positions, deep breathing, acupressure, massage, and many more. So let's say you're in the car ride and you're going to the hospital and you plan on getting an epidural. How are you going to stay comfortable in the meantime? The cool thing about comfort measures that are non-medication forms of pain relief is that you can use them almost at any time, and you can use them with an epidural to help lower your anxiety and to help you feel calmer. So in the end, this is where taking a comprehensive childbirth class or hiring a doula can be a huge help, because that way you'll have more tools that are available that, whether or not you intend to have an epidural, you'll just have more things at your fingertips that you can use to manage your comfort. One more thing I want to talk about before we wrap up are the practice guidelines on having an epidural during labor. So professional organizations that provide guidance to obstetricians, labor and delivery nurses, midwives, and anesthesiologists all have their own guidelines on epidural use during labor. And these can be helpful for us to know about too, as birth workers, as parents. So what is going on? What do they recommend? So I'm going to give you 3 examples of professional guidelines about epidurals. ACOG, the American Congress of Obstetricians and Gynecologists, state that unless there is a medical contraindication that would make it dangerous for you to receive analgesia, that an epidural should be provided to anyone who requests it during labor. Your provider can talk with you more about reasons why you might not be able to have an epidural, but some of these include heart diseases, spinal or muscular diseases, and very low platelet counts. The Association of Women's Health Obstetric and Neonatal Nurses, or AWON, provides recommendations for regional analgesia across the different stages of labor. For example, they strongly recommend that the status of your baby in utero and your health status be checked before the epidural is administered and be monitored while the epidural is in effect. This includes monitoring the baby's heart rate and your blood pressure, oxygen levels, and temperature. The American Society of Anesthesiologists recommends that you be given the option of regional analgesia at any point during your labor, regardless of cervical dilation. So they say basically in early labor, you can have an epidural if you request it. And evidence does not suggest that getting an epidural early in labor will increase your risk of cesarean. The American Society of Anesthesiologists also recommends that an epidural could be placed earlier in labor if you're attempting a VBAC, or if you have certain risk factors such as giving birth to twins or preeclampsia in case you needed urgent surgery. However, here at EBB, we like to talk about informed consent. You always have the right to say yes or no to any intervention that's offered to you. So after all that info, what's the bottom line? The bottom line is that epidurals, spinals, and combined spinal epidurals are very effective ways of managing pain during labor. And they're quite common, more common in the United States than in other places. However, even though they're common and they're effective, they do have side effects you'll want to be aware of as you make an informed decision about whether to have an epidural or not. And you also want to be aware of the alternatives that are available, both medication alternatives and non-medication comfort techniques, so that you can use those other measures if you need them before, during, or after the epidural is placed. We cover lots of comfort measures here at EBB on our podcast and this YouTube channel. You can check out more videos that we have on pain management techniques. One of the cool things about the non-medication pain techniques is that in addition to being able to combine them, they usually don't have any side effects. So they're kind of like risk-free ways to help manage your pain. And then you can always opt for medications as well if you need an additional form of pain relief. So I hope this overview video on epidurals was helpful for you. We plan on releasing other videos about epidurals and the pushing phase and epidurals and the impact on lactation. So stay tuned. Make sure you subscribe to our YouTube channel to get updates when our new videos come out. And until then, go ahead and check out our other videos on pain management, and we hope you find them helpful. Thanks everyone. Bye.